So I'm in my medication room. I am going to be doing hand hygiene. I have my provider's orders as well as my medication administration record. I'm going to be verifying and seeing that I don't have verifying my provider's orders, and I'm also looking at my MAR and my provider's orders to see that there are no discrepancies between the two. Looks like I have orders to administer to a Tracy Jones, date of birth 2/14/1943. I have orders to give insulin, 5 units, subcutaneous injection, as well as acetaminophen, 325 milligram tablet PO. Both are ordered for now. I don't see any allergies on the patient's chart to either of these medications or any other contraindications. So I will go to my med dispense and I'm going to pull out those appropriate medications. So these are labeled appropriately, so I'm going to make sure I have acetaminophen, 325 milligrams. Okay, and then I'm going to pull out from my medication or my med dispense. I have my regular insulin. I'm going to verify at this time that I don't have, neither of them are expired. I'm going to be doing my first label check to see that I do, and for each drug, I'm going to be comparing the label to the MAR to see that I have regular insulin. It's going to be 5 units, subcutaneous, and it's ordered once daily, or we're going to do now for this purpose of this return demonstration. And then I do have also acetaminophen, 325 milligrams, PO, which is orally now. So I'm working with the right patient as confirmed earlier, and I do have the right medication, or the right drug, the right dose, the right route, as well as the right time. So I'm going to begin preparing my medication. So I'm going to make sure I just give myself some space here. I'll put that into the cup so that's ready to go, to give myself some room for my insulin. That should be good. You can always do extra hand hygiene if you want. Okay, I will be using, oh, and at this time too, before I start pulling up anything, I would make sure also that I did any calculations if they were necessary, and I would ask another nurse to verify and double check those medication calculations that I performed. So I'm going to be drawing up my insulin, and I'm going to use an insulin syringe. And again, I will be drawing up 5 units. So I'm going to make sure, sorry, I see where my 5 is. Okay, pull that up of air. I'm going to wipe off the top of my vial in a circular motion, and I'm going to allow that to dry before I pull up anything. So we'll say that's dry for the sake of this video. I'm going to uncap my needle. I'm going to, without my finger on the plunger, I'm going to put that into my vial, insert the air, and then I can flip my vial over, and I'm going to pull up to my 5 units. And so sometimes you might get a little air bubble. Hopefully for the video I don't get one. Alright. So I'm going to say I'm at my 5 units. And at this point too, I can ask another nurse, since it is insulin, to verify that I do have 5 units in fact. So I can take that off, and then you're going to want to make sure that you recap with a single-handed scoop, so that way you are not hurting yourself. And normally you can stick it against like a wall or whatever. Here we're going to do it against the table, but it still has to be that single-handed scoop. So now I'm going to do my second medication label check. So again, I do still have for each medication that I'm doing, I'm going to compare the label against the MAR. So again, I have to verify that I have the right drug, the right dose, the right route, and the right time. I do have regular insulin. It's going to be 5 units. I had another nurse verify that. It will be done subcutaneous, and it is due now. And then I do have my acetaminophen, again, 325 milligrams to be given PO or orally, and I'm going to have that ordered now. So I do have those 2 verified. So I'm going to make sure I don't open my medication at this time, and I'm going to be taking everything that I would need into my client's room, to include my computer, which we have on paper here for you though. I'm going to bring gauze, bring some alcohol. All right, I'm gonna go to my patient's room, so I'm gonna announce myself. So knock, knock, is it okay if I come in? All right, thank you. Put all these down on a clean surface. Really quick. All right. Hi, Mr. Jones. I'm gonna just do some hand hygiene really quick. Give us some privacy. My name is Anna. I'm going to be your nurse here today. I do have a few medications with me. Before I get started though, would it be okay if I just checked your name and your date of birth? And I can compare that again to my record here. So my patient has told me, again, Tracy Jones, and then the 2/14/1943, which does match to my record here. Perfect. And then do you have any allergies? Patient said no, and then I will be giving you acetaminophen as well as insulin. Do you have any contraindications to either of those medications? No, thank you. So I am here to give you, as I mentioned, insulin, regular insulin as well as acetaminophen. So the insulin is because your blood sugar is a little elevated, and then the acetaminophen, also known as Tylenol, is because you're been having a little bit of a fever. Okay, let's see. So do you have any questions before I begin? No? And then do I have your verbal consent to proceed with the procedure of administering the medication to you? Okay, thank you. And just so you are aware, with the insulin as well as with the insulin and any medication that you get, we'd like you to know of any adverse effects. So for insulin, for instance, that could drop your blood sugar far and make you experience hypoglycemia. So we're going to be watching out for any adverse effects. So at this time, I'm going to raise your head of the bed up to about 30 degrees. Do you have a preference in which medication you'd like to get first? No. And at this time, before I proceed, I'm also going to just be verifying. I'm going to do my full focused head to toe assessment, and I'm going to make sure that I've also done vital signs at this time, and then I'm also going to have assessed your ability to swallow. So again, all those things are now done and complete. My patient has verbalized that they would like to get their injection first, so their insulin. I'm going to do my last medication check, so my third label check. I did bring my vial in here. There's no isolation precautions, so I can verify again my label against my MAR for each drug that I'm giving. I've already verified my patient's name and date of birth, so I do have the right patient. I'm going to say, I'm looking, I do have the right drug, the right dose, the right route, and the right time. So again, I have regular insulin, 5 units, to be given subcutaneous once daily, which is the time for that is appropriate to right now. And then our acetaminophen, so acetaminophen, 325 milligrams, PO, which is by mouth, and due now. Perfect. And so you did say you wanted to have your injection first. So I'm actually going to raise your bed up just because for my back I need you a little bit higher. I'm going to move this down a little bit. Okay. Okay. I'm going to do my hand hygiene one more time. Okay. I'm going to put on gloves. Right, and I'm going to be exposing your abdomen if that's an okay location for me to give you your injection. Patient says yes. So I'm going to just expose your abdomen. Right, and I'm going to be inspecting the area that I'm going to be giving the injection for any lesions, bony prominences, inflammation, or trauma. So I'm going to be giving the injection in here though. So I'm going to see if this actually holds in place for the realism here. So I'm going to be squeezing your abdomen. You're going to feel in my hand because I'm just going to locate an area of adequate subcutaneous tissue. It looks like here should be good. Again, I'm going to make sure I'm at least 1 inch away from the umbilicus, and I've determined that I can go at a 45 to 90, so I'll do a 90-degree angle based on how much I can pinch. I'm going to grab my antimicrobial wipe. I'm going to wipe in a circular motion moving outward at least 2 inches out. And that's about as far as I can get on that pad. Oops, I would make sure I had a garbage can. I'm going to take my insulin. So again, you're gonna feel my hand on you. You're gonna feel a little bit of a stick. I will warn you though. So I'm going to uncap my needle. Uncap just nice and upward. I am going to make sure I have my gauze readily available. At this point, I'm gonna squeeze your skin. So your subcutaneous tissue. You're gonna feel a little bit of a stick. I'm going to go at a 90-degree angle is what I determined, so nice and straight without my finger on the plunger. So straight in. I'm going to release the subcutaneous tissue with my non-dominant hand, stabilize my syringe, slowly inject my medication, come back down. I'm gonna release my non-dominant hand away. I'm gonna make sure my skin might move. I'm gonna come out in the same direction that I came out or came into the client. I'm gonna ask my client to hold that there. I'm gonna activate my safety, and then I'm gonna throw this out into the sharps container. My patient has been hanging on to the little piece of gauze here. I'm just gonna remove that. I'm gonna assess for any redness, bleeding, or reaction. And then I'm going to be tossing this out into the garbage that I will pretend I have a garbage. I'm gonna toss that into the garbage. All right, so then I'm going to cover you back up. I'm gonna just move that to the side here. I would offer to put a Band-Aid on my client if necessary. However, that's not necessary for my subcutaneous injection. Right, is that comfortable? Okay, I will remove my gloves, toss that out into the garbage. I'm going to do some hand hygiene. At this time, I'm going to make sure that my client's head of the bed again is still at a 30-degree angle. Are you comfortable? Okay, so I do have that Tylenol for you. So I'm going to pop that out of the cup. You don't actually have to pop it out for this return demo, but I would pop it out into the cup so the wrapper's not on it. I'm going to give my patient their water with their straw. I'm going to give them their medication. So he took it. And so I administered it. My patient did swallow it. I saw them take a sip of their water. There's no pill left in my client's mouth. So then again, I can now leave their water. I can discard all of this into the garbage. Make sure I take all of this with me. That's all gonna be garbage. All right, and so my patient has taken their medication. I'm going to do hand hygiene one more time. I'm going to be lowering your bed to that lowest position. Are you comfortable with your head of the bed up at 30 degrees, or would you like me to lower it? Set a little bit lower. Okay. I'm going to be back down in the position they were in, or about, there we go, perfect. I'm going to make sure my patient has their call light within reach. The bed is locked. I did make sure any side rails are up if I had ever put them down. So let's see. Bed locked, lowest position, call light within reach, side rails up if applicable, and then thank you for your time. Let me know if you need anything. You just press that call light. Thank you. I'll do my hand hygiene.